Greetings, folks. This is Scott, and you're tuning into A Woman's Place, the podcast where we break down all the policies and politics that affect the 51%. That's right, women are half the U.S. population, and Ashley and I are here to give you the facts about how today's events are affecting them. Find us on Spotify, Apple Podcasts, Amazon, YouTube, or wherever you get your podcasts. Good afternoon, Ashley Brown.
Good afternoon, Scott Osborne. It has been a minute since we've seen each other, so good to see you.
It has. It's nice to see you.
Yes.
You're
And
back in Sarasota?
back in Sarasota. By the way, knee rehab going really well.
So glad. That is such a wonderful story.
I know I was told at PT today that I needed to be a little more patient with myself and that I have greater expectations and I am ahead of the curve. And I'm like, maybe that's a topic for a woman's place one
There
day.
you go. There you go.
I
Maybe the
know.
curve needs to be readjusted.
I know. So,
So,
catching up last time, good
yes.
conversation.
Yes, we talked to Sue Hoffman about women in the skilled trades. And I don't know about you, but I learned a ton. I found myself looking it up and Googling different things and saying to people, hey, have you considered electrician work? That sort of thing.
Absolutely. Absolutely. Especially if and I just think encouraging people to think about what their natural passions are and what they're naturally drawn to. And if it doesn't align with what is traditionally thought of as male versus female, who cares?
Yeah. And I
Right?
think we should, in a future show, we should get on some women in the skilled trades and talk to them about what it's really like. I'd love to do that. And it's definitely an issue here. So I love that conversation. So if you haven't heard it yet, definitely look it up. But
Absolutely.
we switch topics today.
Oh, we're switching topics today and I like it.
Yes, we are. So today we're on menopause, and is menopause having a moment? Though after doing some research on this, I've decided perimenopause is really having a moment, but we're going to start with menopause and sort of work backwards. So we're going to dive into all things both medical and cultural about menopause, something which will affect all women, even if you are not in menopause, it will affect you. So you want to listen up, and we're going to be speaking with a wonderful guest today. Should I go right ahead and talk about her?
Yes, and she's fabulous.
Yes, she is fabulous. So this is our guest is Kelly-Ann Shedd-Hartman, who goes as Dr. Cash, K-A-S-H, if you're actually looking her up. She's a board certified OBGYN here in Sarasota, Florida. She works with SWOR Women's Care, which is a small local practice. She earned her undergraduate at Colorado State University, her medical degree at Lake Erie College here in Bradenton, and then did her residency in obstetrics and gynecology at St. Vincent Medical Center in Toledo, Ohio. And today she specializes exclusively in the full range of gynecologic care, including preventative medicine, treatment of gynecological concerns, surgery, all kinds of holistic approaches to women and their bodies. And I know many people who know Cash as a patient and as an advisor, and she's got the info. So let's get started.
Absolutely. We will welcome her in.
Okay. We are just waiting.
There she is.
Hi, Cash.
Hello.
Welcome.
Welcome, welcome.
So we are all ready to dive into all things menopause. We've said that every woman should listen to this regardless of age because they will get there at some point. So we're going to dive in, and we'd love to talk first about some of the changes in medicine. We want to talk at some point about cultural issues and kind of how women talk about this, but we'd love to first hear some medical perspectives on, I guess, how you think some of the big things have changed. And let me just say, from my generation, there was a time when it was like, oh, you don't want to do anything to treat menopause. Those hormones are bad. That was kind of the popular conception. But I think you would say that's probably not exactly accurate. Is that right?
Yeah, so thankfully, that has really started to shift. And I would say in the last maybe even 5 to 10 years, especially. And we are seeing more women who are not only recognizing that they have menopausal symptoms or that their symptoms are related to menopause, but also reaching out, feeling confident in contacting their providers or even talking to friends or family about menopausal symptoms. And that's historically has not been the case. We've kind of shrouded menopause in secrecy, and that was just something that women were unfortunately left to deal with kind of on their own.
They were just over the hill. No more babies. Sorry for you, ladies.
Yeah, yeah, and I think women are recognizing too that menopause is not just a moment. It doesn't occur
Mhm.
in a day or a month or a week or a year. Menopause is really that second half of your life. And women now are recognizing that and that there's actually treatment for that.
So let's back up a minute. What actually, people may not know, what are really some of the big symptoms? I mean, what are the kinds of things that people come to you talking about, or maybe symptoms of menopause that they don't even associate with menopause?
So I most more traditionally you might hear maybe your grandmother had hot flashes or
Mhm.
someone said that that they had trouble sleeping or difficulty concentrating, but there are an amazing amount of menopausal symptoms or what I call menopausal correlates, meaning maybe they're
Okay.
not directly associated with menopause, but that they could be improved by treatment of menopausal symptoms. So those include hot flashes, night sweats, vaginal dryness, pain with intercourse, um, recurrent urinary
My
tract.
grandmother did not tell me about the pain with intercourse part. I'm just
Absolutely
for the
not.
record. I'm just
Prohibited.
saying.
Prohibited.
Did your grandmother even talk about menopause?
No!
Right?
Oh, my grandmother,
No,
no way. No way. Never heard of
no. It
it.
was
Okay,
like,
sorry.
yeah, no.
Yeah, it probably only secondarily in secrecy to, maybe getting your period or becoming sexually active, menopause, um, and recognizing what those symptoms would be. So things like joint pain that we historically have always just
Oh.
attributed to us aging. And sure, that is a byproduct of aging, but we know that estrogen has anti-inflammatory properties. And as we lose estrogen, we start to see the shoulder's a little bit more achy,
Hmm, hmm.
maybe some neck pain, and so many symptoms are actually a component of menopause that we're just under recognizing or attributing to something else, aging.
So two questions. Do we know that there's like something like joint pain exactly, which people might say, well, I'm getting older, or it's a touch
Mhm.
of arthritis, or all those things. I mean, do we see that estrogen can change that? I'm trying to think how you would even like study that because women's bodies vary so much.
Yeah, so there actually was a study where it was about frozen shoulder, and they had women who had gone through physical therapy and different dietary changes, and they went through all of this different testing. And when they were placed on hormone replacement therapy, estrogen specifically, they started to notice that that frozen shoulder improved when other therapies had failed.
Hmm.
Oh.
So there have been studies, it's just not really put out in the general media.
And what about the thing that just so many older women who lose control of their bladder so much? I mean, that's related too, right?
Absolutely. So bladder health absolutely relies on our hormones. And of course, depending on how many babies you've had, things like obesity, smoking, those all affect our vaginal tissues. However, we can optimize our vaginal tissues so that we create thickness of the vaginal tissues and elasticity. And both those components are really important in maintaining bladder health. It also helps with the microbiome of the vagina.
Mhm.
And so decreasing our risk of bacterial infections, i.e., bladder infections, yeast infections, those sorts of things.
Mhm. Okay, so let's assume that women now come in are more likely, and we'll talk about how they talk about it and the taboos in a minute, but they
Hmm.
have some of these correlations. Have the treatments changed? What you can actually do? They come in with these issues. I mean, is there a spectrum of treatments that are safe, or how do we think about some of those protocols?
So there are actually a lot of treatments, and I tell patients it's not a one size fits all. In my practice, I use everything from non-hormonal treatments to bioidentical to synthetic forms. And then also the route of application varies widely. There's vaginal treatments, there's topical patches and creams, there's oral supplementation. So there's really several different ways in which we can treat those symptoms. And if someone is not a candidate for hormone replacement or they do not want to be on hormone replacement, we also have options for those patients as well.
Like what?
So some of the things, for example, for vaginal dryness, there are special vaginal lubricants that can be effective. There are vaginal lasers, which are not painful,
Okay.
surprisingly. There are things like hyaluronic acid, which we kind of primarily think of as something we use in our face
Mhm.
creams to make ourselves look more useful, but actually help to restore vaginal moisture. So that alone can increase vaginal health.
A big range.
So one of the things that we've talked about in different topics is access and insurance coverage, and you get the health care you can pay for or afford. So what kind of insurance options are they? Are these mainly you're paying out of pocket? Do insurance providers give some coverage
Wait a
for?
minute, is this when you want to talk about Viagra coverage, Ashley? I know you want to.
You know I do, Scott.
No,
You
we're
know
gonna
I
let
do.
Cash take this one straight.
So historically, insurance has not covered hormone replacement therapy well, or they've undercovered it.
Mhm.
But now that women are asking for it and that it is being proven time and time again to be safe, it is becoming something where we are demanding that it is being covered. And so some things, like specifically your synthetic hormones, they often tend to be covered at least partially, if not entirely. Sometimes some of the supplemental treatments, like the hyaluronic acid suppositories
Mhm.
or a vaginal laser, or even bioidentical hormones like pellets, those are not usually well covered. However, they might not be prohibitive as far as cost for a lot of people because they can range anywhere from $35 a month, maybe even a couple of $100 a month. But depending, we can usually work within a budget for most patients.
So, what can you explain bioidentical hormones a little bit more as
Mhm.
opposed to synthetic?
Sure. So, when we talk about bioidentical hormones, so they're made in a different way than a synthetic would be. The synthetic is made in a regular pharmaceutical lab and it is FDA approved. So that's important. However, it's more rigid. We don't have a lot of flexibility. There's very specific dosing and we don't have a lot of flexibility in adding or subtracting components. Whereas something like a bioidentical, it's made by a compounding pharmacy. So I can literally add the components to it, whether that's estrogen and progesterone or estrogen, progesterone, and testosterone to be specifically formulated for that patient. We also can give it to patients in a way that offers us to allow like a sensitive base if a patient has a sensitivity or maybe tweaking components as opposed to just giving them one standard dosing.
Okay, okay.
Um, so that I think is beneficial. And some people will argue that because of the routes, which is usually a transdermal approach, that it's a little bit safer than something that you would take as an oral pill, like an oral estrogen.
Hmm. So, just while we're staying on the medical, and I know there was this study, I guess that sort of was what created this notion that hormones were risky, I guess. I mean, I'm thinking from popular literature, breast cancer, you heard a lot about that. I mean, I gather one that's changed, and maybe you could say a little bit about, were we mistaken? Was it just misunderstood? Or what do you think?
Mhm.
How did this notion get started? And because I think it's still quite prevalent commonly. You may not see it in your practice, but I think in the common world, there's very much that feeling that, oh, might not want to take hormones kind of thing.
Sure, and that I find probably daily in my patient population. Someone is asking about whether or not hormone replacement therapy is safe or if they are addressing menopausal symptoms. And I suggest hormone replacement therapy. They're very fearful that it would be harmful to their health. And you're right, there was a Women's Health Initiative study done in the early 90s, and it really demonized hormone replacement. It made us feel that if we were going to do hormone replacement therapy, then we were putting our health at risk. Then what we found is that study actually did have quite a few flaws, and the benefits of hormones were underrepresented in that study. So now we're really going back and trying to essentially, we can't rewrite history, unfortunately, but trying to assure women that hormones are actually safe if used effectively. And we are properly evaluating our patients to make sure that they don't have some of those risk factors that would exclude them from being on hormone replacement. But yes, in fact, that study it unfortunately made a lot of women very fearful of being on hormones. And thankfully, now we're really starting to see a reversal of that data to prove that hormones are safe and effective.
I know you're
Hmm.
pretty progressive about this. Do you think most physicians have sort of caught up, or are they still in the same place with those kind of, I guess I would say maybe outmoded notions? I mean,
Sure. So
I don't know how to generalize.
Right.
yeah, I think that we are starting to see so much in the media, whether that's TikTok or Instagram, or Facebook, where patients are really kind of spearheading this, where they're acquiring a lot of information and they're talking to it with their providers, and then it's forcing the providers that maybe are not educated or undereducated to become educated about it, which is really wonderful. But I do think there are a lot of physicians and women's health practitioners who are kind of in that same mentality that we've all been in, which is that hormones are unsafe. So I would really encourage patients to research people who are comfortable with it, who have been prescribing hormone replacement, because you really do want someone who not only is going to advocate for you, but also someone who's going to understand who's a candidate, who's not, and how best to help you.
Well, and I think advocating for ourselves. I think that's so
Absolutely.
important we know our bodies if we're listening to them better than anybody else. So being willing to talk about it. Scott, you had a great conversation topic about more women in medicine, and is that changing the narrative or the
As
conversation?
physicians, more female
Mhm.
physicians, if that's changing things,
Yeah.
yeah. If that makes a difference. I don't know, Cash, you obviously can't see it as a man, but I think from the patient side, for many, I kind of have to think it is, but I can't prove that it would
Right.
be easier for them to have the conversation with a female gynecologist than with a male. I don't have to show that, frankly.
Yeah, so it's interesting. I think that you can depend, and it is very generational. I think, women who are maybe in their 70s and 80s, they may have been part of more like what we call patriarchal medicine, where it was your doctor knows best and they, kind of dictate your health and you don't ask a whole lot of questions. But they also have more of a trust for a male physician. But the younger generations, I think, are not only feeling like the female might relate to them better, but they're also feel, like you said, a little bit more comfortable talking about, parts of their body that maybe aren't optimally functioning or some of the symptoms that they're having. So I do think that, if you are a female practitioner, there is a pretty good possibility that your patients are a little bit more willing to open up to you as far as their health concerns. So I do think that's not just a perceived notion you're having. I think that's accurate.
So I want to talk more about the cultural stuff, but I have one more science question. So aging women, I mean, we've talked about something like joint pain or maybe cognitive issues or bladder issues. I'm sure it was always considered part of aging because menopause was part of aging, and the two are just, side by side like this. It's like, well, that's what older women
Mhm.
experience. So how do you pull them out? What is quote unquote menopause? How much has the science or how do we know more about how all of these hormones work, and has some actual science driven those understandings? In other words, joint pain maybe isn't just overuse from tennis, but it's really related to estrogen, for example.
Mhm.
I mean, I like to think that our scientific notion of how the body works, which has exploded in the past 30, 40 years, but I don't know that. Do you see what I'm saying?
Absolutely. So, I mean, you're exactly right. So, one, we are learning so much more. I mean, now commonplace to think about gene therapies and how we're able to change our body chemistry and really our body DNA by just certain things that we eat or how we live our lives. So we are learning a lot more and are able to provide evidence-based medicine to patients. So you're totally right in thinking that.
Interesting. So
It
let's
is.
go, sorry, a little bit more to we talked about some of the cultural stuff and women speaking up. And there's certainly so much more information, especially with younger generations, but I think older generations too. I mean, my mom is in her 90s and will be like on Facebook, I read this thing about, some medical issues. So how much is all that information that people are coming to? And is there a downside to that, I wonder? I mean, obviously I don't want to keep valid information, but are we seeing also bad information on this one?
Yeah, we are. And here's the thing. I mean, in every facet of our lives, we are using more in the way of social media. We have Chat GPT. We have a greater access to information than we've ever had. And I think we can look at it two ways. On one hand, of course, is it frustrating that people are, there's a lot of great information, but there's a lot of misinformation, and patients are seeing that and maybe falsely treating themselves or kind of coming to conclusions that are inaccurate? Yes. But I kind of think of it as how great is it that when my patient comes to me, they've already done a little bit of research on their own. So a lot of times I'm seeing patients, especially younger generations, but maybe even your mom at 90, if they're able to use the internet and these resources, they're actually coming to me and telling me what they want. And then we work collaboratively to come up with a healthcare plan. So I actually really try to view it as a positive, that people are kind of arming themselves with information. And then my thought process is that I'm here to help to kind of quiet the noise of the misinformation. But also they come to me with some information that, maybe I have only, seen out in, an article, but I haven't really seen for an actual person. So I think it can be super helpful. I wouldn't view technology as a negative or a drawback in this regard.
Mhm. And I wondered too, just on the cultural issues. I mean, the generation, as we say, the baby boomers are aging older than I am, and that's the generation that had a whole different view about sex and talking about
Mhm.
sex. And how much is it that older women, in many cases, are expecting to have active sex lives well into their senior years? I mean, do you think that's part of the change?
I think especially maybe it's just because we're in Sarasota, Florida, where we have a disproportionate amount of seniors. But yeah, I think that we are seeing a lot more in the way of seniors or postmenopausal women engaging in sexual activity. And where before it was kind of considered taboo if you became a widow for you to remarry or to date again, we're seeing that reversed a little bit. And so that sexual health component is super important. Now, decreasing that barrier, though, because for me, I talk about sex every day. I talk about female body parts every day, symptoms of menopause every day. But for a lot of people, I think, Scott, you had voiced at one point that it's still uncomfortable to talk about.
Mhm. Mhm.
Now it's not uncomfortable for me to talk about. So I,
But
I
you
think,
exactly, you're
yeah,
dealing with
Right.
it day to day. I think for the average person, I said to Ashley, except for maybe, the image of a woman with a hot flash, which has made its way
yeah,
into movies, that's like,
yeah,
okay.
yeah.
I don't know, especially, I mean, it changes with age, but I'm not so certain even that many younger women I just think the comfort level is not always what we think. Just because it's out in popular media,
Sure.
we kind of schizophrenic. But in real human conversations about one
Yeah,
person's own state of their vagina, I don't think there's a lot of
sure.
comfort with that yet.
Yeah, and I think that one
Go
of the
ahead,
ways,
Ashley, go for
Ashley disagrees.
I would like to talk. No, I would agree.
Yeah.
it.
Yeah, I think that that is a really important point to make. And I think that that is where a healthcare provider can make a huge difference because in our office, not only do we post lots of informational signs. Maybe we have a poster up that talks about hot flashes or symptoms of menopause that patients are kind of looking at as they're sitting waiting for the exam. But also, we just try to normalize it. I ask patients almost as if I assume that they have every single menopause symptom in the book. So that they just kind of know that that's normal and running through that list in a very unbiased way. I think it gives patients a little bit more of an opportunity to say, oh, well, now that you mention it, I have that, as opposed to just asking a patient, well, are you having any problems with menopause or do you have any problems, that you want to talk about today? I think that that becomes a really imposing question where patients maybe are afraid to say the wrong thing. They're embarrassed by maybe this symptom is not what my mother told me as far as a hot flash. and sometimes just embarrassed about their own sexuality. So as practitioners, I think if we can invite that space where we make patients feel a little bit more comfortable, that's kind of on us, I think.
Good. Yeah. And I think again, we don't know any other aging than aging in menopause. So how do we separate out? I mean, if I
Mhm.
have all these body feelings, I
Yeah,
don't walk around thinking, oh, well, this is just my age and this is menopause. I mean, you don't think that way when you're just
sure.
a person.
Yeah. Yeah. And I think importantly, I tell patients all the time, this is my job. This is what I see all day, every day. It's not your job to figure out what you have. It's your job to come to me with your symptoms
Mhm.
and your questions and your complaints, and then let's work together to try to figure out what it is. So I tell my patients, and I would encourage anyone out there listening, just kind of write down those questions. Sometimes I have patients like we have a patient portal that's really helpful. Sometimes it's less
Mhm.
embarrassing to write something through a patient portal than it is to have a face-to-face conversation. But just in some way, bring up those things that maybe you think could not even be related, because that's helpful for me in trying to assess, best treatment modalities and also just like overall your health status.
Mhm. Interesting.
Well, and Scott, I was thinking the same thing. Even like the joint pain, I had never even heard that before. And it, being able to help women understand that there could be a wide range of symptoms that don't have to be really hot flashes and rage seem to be the stereotypical. Right. I had rage, I think. That was my strong. But no, just which I think goes with all of the things that are happening with your hormones, that you can have those moments of questioning yourself too, I think, of what am I feeling? Is this normal? And how do I talk about it? So I think normalizing talking about it is super important. So,
I also wonder too, now we're getting back into the age and what age it happens. For many women, especially if they have children, when menopause hits, they're often in the throes of some of the most
mhm,
intensive times of child rearing, probably some of the most intensive times of family in many cases, career,
mhm,
work, etc. Very often that's when it's just like you're getting through the day. I mean, I will be very, many people just they don't remember those years. They're just getting through every day sometimes. And so to think, oh, I've got this little thing, it's not life threatening. I think many women wouldn't do anything about it. No question.
mhm.
Yeah, I think women do a lot of times, we're warriors and I think we power through a lot of situations or we're busy taking care of our families, so we don't prioritize ourselves. But again, if you are going to even just your well woman annual exam,
Mhm.
just even having that open dialogue, or like I mentioned earlier, using a patient portal just to kind of vocalize some of those symptoms. Maybe it's, late at night once the kids are in bed and you can kind of write that through the portal just so that there's some way of getting that out there. Because I think, to your point, you are in perhaps a stage where maybe you have teenagers, or, maybe you're in the middle of your career, and so you are really busy. But going through those symptoms and being, non-treated or undertreated actually affect all those facets of your life. And I've had patients who have said, gosh, like you said, Ashley, I felt rage. And they said they said, gosh, I was worried I was going to get a divorce during that time, because I just couldn't get a hold of my emotions. Or I had a teenager, and even though teenagers can be challenging, I felt like I was constantly angry at them. And so if you think about it, maybe that time becomes less stressful and more manageable if you have some help.
Absolutely.
So we are
Absolutely.
almost out of time. I love this. We could always keep talking. And I
Yeah,
think we're going to do a follow-up on perimenopause because
I love it.
perimenopause is really
Yes.
having a moment. But can you, and just really quickly, Cash, if you really wanted people to take away something, what would you suggest that should really stick in their heads?
If I had to say one thing, it would be, advocate, 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 advocate for yourself.
Hmm.
Advocate, when you're in the doctor's office, when you're talking to friends, like don't be afraid to ask questions. And don't be afraid to reach out in any platform, because knowledge is power, and we are truly here to help. So absolutely, just advocate.
Beautiful. Thank you.
I love
Dr.
it.
of SWOR Women's Care, we cannot thank you enough. I hope
Thank you so much for having me, ladies.
follow-up. We really appreciate it.
All right, take care.
Thank you,
Take care.
Dr. Cash.
Thank you.
Bye-bye.